Hello, my name is Brooke, and I will be your nurse for the surgery process. It's very nice to meet you. I am just going to go over a few things about Mohs surgery that will be performed today. Please let me know if you have any questions. I'm going to start off with the goals. So the goal of the surgery today is to remove any cancer cells within the area that were noticed during the biopsy. This process will be done in different stages until it is certain that all the cells are removed. You will be awake for the removal, but we will use anesthesia around the area. That way you do not feel anything. So this type of cancer that we are removing is called basal cell carcinoma. It is the most common type of skin cancer, usually caused by overexposure to UV radiation or ultraviolet radiation, resulting in the overgrowth of basal cells. The tumor can look different for everyone and can appear as an open scar, red patches, a pink growth, or in your case, a shiny nodule. The person completing your surgery today is a dermatologist who has plenty of experience completing this type of surgery. As I mentioned before, the surgery will be completed in stages. The first stage will consist of the dermatologist making marks around the area for guidance. We will then inject the anesthesia, and the doctor will begin by removing the visible nodule with a scalpel. I will then patch up the area and have you wait in the waiting room while we send the cells off for a lab analysis. This process will be repeated until we don't see any more cancer cells, and then the surgeon will stitch the area up if needed. This process can also take several hours as well if more than 1 or 2 rounds are needed, and the process of waiting on lab results, of course. It is very important to follow all post-op recommendations and use any of the tools that we may give you to minimize the risk of scarring. We will have you follow up within the next 2 weeks or so to remove any stitches if they were needed. Do you have any questions before we begin?